One reason Candida auris is so problematic is that it is difficult to identify because it is similar to other yeasts. The appearance and color of Candida auris colonies in culture can provide some clues for species identification, but this should not be relied upon as the sole method for identifying Candida auris. For example, Chrome agar Candida plus, a selective chromogenic culture medium, is intended for differentiation and presumptive identification of Candida species, including Candida auris. It is not meant for diagnosing infections or for guiding or monitoring treatment of infections. This is a plate of 5 different isolates of Candida species, demonstrating the proper colors for Chrome agar Candida plus. 1. Candida auris, light blue with blue halo. 2. Candida albicans, green-blue. 3. Candida tropicalis, metallic blue with pink halo. 4. Candida krusei, pink and fuzzy. And 5. Candida glabrata, mauve. Apart from Chrome agar Candida plus, other manufacturers produce chromogenic yeast agars with varying color presentations. Refer to the manufacturer's instructions for interpretation. Candida auris can be misidentified as a number of different organisms when using traditional phenotypic methods for yeast identification, such as Vitek 2YST, API 20C, BD Phoenix Yeast Identification System, and Microscan. Misidentification can lead to inappropriate patient treatment and delay appropriate infection control precautions. The Centers for Disease Control and Prevention provide resources laboratorians can use to identify possibilities for misidentification. The information is based on current knowledge of Candida auris and is subject to change as additional information becomes available. Consult with the manufacturer on the capabilities of the identification method and library database used in your laboratory to determine how best to interpret results. Some methods commonly used for the definitive identification of Candida auris include matrix-assisted laser desorption ionization time-of-flight mass spectrometry, typically referred to as MALDI-TOF. If your lab has MALDI-TOF, ensure that Candida auris is included in the database. Molecular methods based on whole genome or targeted DNA sequencing. And real-time PCR. Regardless of the method used, you must validate the instrument to confirm that it can identify Candida auris. If your lab does not have the capability to identify Candida auris, work with your local or state health department. You may be able to use a public health laboratory to confirm identification, or a clinical reference laboratory. Candida auris often displays multi-drug resistance. However, the extent of its resistance to antifungal drugs can vary greatly among isolates. All Candida auris isolates should undergo antifungal susceptibility testing, following the guidelines set by the Clinical and Laboratory Standards Institute, or CLSI. Antifungal susceptibility testing is critical in making a clinical treatment decision. If your lab does not perform antifungal susceptibility testing, the clinician may order additional testing at a clinical reference laboratory. Currently, there are no established susceptibility breakpoints specific to Candida auris. Therefore, breakpoints are determined based on those set for closely related Candida species and expert consensus. A higher minimum inhibitory concentration, or MIC, for an antifungal drug should not automatically rule out its use, particularly if other antifungal treatments have proven ineffective for the patient. CDC's Antimicrobial Resistance Laboratory Network Mid-Atlantic region, shown here in pink, shared recent data estimates on antifungal resistance. These data revealed that in the Mid-Atlantic region, approximately 85% and 90% of Candida auris isolates were resistant to azoles and amphotericin B, respectively. If Candida auris has been identified at your facility, you may be asked to perform retrospective surveillance of microbiological data to detect any indication of possible Candida auris from a patient at the facility. This review should encompass the period from the initial admission of the index case to the start date of prospective surveillance. Conduct prospective surveillance for 3 months from the date of the last positive. Track and report any specimens suspicious for Candida auris. Identify the yeast species in all samples collected from patients at your facility, including those from both sterile and non-sterile sites, even if this is not standard practice. If the volume of this request is not feasible, speciate all yeast from patients in the affected units. Discuss options for yeast speciation with public health if your laboratory does not have this capability. When working with known or suspected Candida auris isolates, laboratory personnel should adhere to strict safety precautions to minimize the risk of exposure and contamination. Key safety considerations for Candida auris include following your laboratory's policy on use of personal protective equipment, or PPE, but use at minimum a lab coat and gloves and eye protection if splash may occur. Use a Class II biological safety cabinet for handling known or suspected Candida auris isolates to ensure safety and sterility. Minimize the potential for aerosol generation during sample preparation by avoiding vigorous pipetting or vortexing that could cause splashes or aerosols. Disinfect surfaces contaminated with Candida auris, including the biological safety cabinet, with an EPA-approved disinfectant specifically for Candida auris. Follow the label directions for Candida auris carefully, including contact time, which is the time a product must remain wet on the surface for it to be effective. Note, quaternary ammonium compounds are not effective at killing Candida auris. Dispose of contaminated materials as infectious waste following your laboratory's protocols. Remove PPE and perform hand hygiene before leaving the lab, according to your laboratory's policy. Lastly, when transporting Candida auris, a sealable secondary container should be used, and this container should be disinfected after use. Collaboration between laboratory personnel and infection preventionists is crucial, as valuable information can be exchanged between these departments. Infection preventionists should communicate suspected cases of Candida auris with the lab and notify public health authorities. In turn, laboratory staff should establish a protocol for alerting infection preventionists about potential or confirmed cases of Candida auris. Thank you for listening today. This video is part of a 10-part video series on Candida auris. To access additional videos, please visit the Candida auris video webpage at health.pa.gov/c-auris-video. For questions about Candida auris, please contact your local health department or call 1-877-PA-HEALTH.